Okay, ladies and gentlemen, we might just get started. My name is Nancy. I'm a clinical nurse with the Mater Refugee Service over at the Mater Hospital, and I welcome you on behalf of Meryl Jones, the Acting Nurse Unit Manager, who can't be here tonight. All right, so now we're going to just hear from the opposite side of Amparo. I'm going to try and pronounce your name correctly. I apologise in advance. Venantie Niragira? Oh, I was so close. So Venantie is I've got my little background here. She's from Burundi in Central Africa, a member of the Burundi community here in Queensland. She was a refugee for 12 years prior to coming to Australia, and she arrived in 2005. So has good experience in this background. Currently, she's working for Amparo Advocacy as a bicultural community education worker and also works for Queensland Transcultural Mental Health Centre as a bicultural consultant. So well present across this refugee space. We welcome you. Thank you very much. Speak right into the microphone.
Good evening, everybody. It's a great pleasure for me to be here, speaking for my community. My name is Venantie, as they have mentioned, and I'm here this evening to speak about my role with Amparo Advocacy as bicultural community education worker. My role at Amparo is to provide information and educate my community about understanding disability in Australia and the NDIS in the most culturally appropriate, responsive, and flexible way. I informed my community in multiple ways, including dispersing information at community events and celebrations, attending masses and speaking to the congregation, engaging with the key community leaders, and using my own networks to speak to community members one-on-one about this important information. I want to take this opportunity to share with you some of the experiences I have had in completing this role. Understanding disability in Australia. First, let me explain how we understand disability within Burundian community. For many, there is a lack of basic understanding of some types of disability, especially non-physical disabilities. This prevents some people with disability and their families to see the need of discussing about their disability and NDIS. Some type of mental disability symptoms are not considered as signs of disability in our home countries. For example, some autism disorders and intellectual disability. The stigma associated with disability prevents some people to accept the disability or to discuss with others. The family will be worried that if others know about their family member with disability, and then people will avoid them, and the future opportunity for that person will be limited. For example, no one will marry that person. This can also extend to the rest of the family members, as it might be seen that the family has bad genetics. Some religious people think that recognizing some types of disability is a lack of faith in God, or accepting disability support other than prayer does not believe in God's power. They assume that a mental or intellectual disability is about bad spirits, and this can be healed by prayer only. These people say, for instance, I know I'm fine, or my child is fine because we are praying, and that's not for them. You can now understand the challenges to engage my community in learning more about disability and the NDIS. However, I have been successful in identifying 11 individuals with disabilities and visiting them and their families in their homes to educate them about disability and the NDIS. I will now mention some of my experiences and feedback from my work. Lack of understanding of what their disability is. For some families I visited, they were unable to tell me what their disability was and what supports they were getting, if any, or the names of any service providers that might be helping them. Access and interpreters. For many families, the complex process to access services and the lack of use of interpreter by services had discouraged families to use services and supports available to them. Lack of desired supports. For many families, they have not been provided with the actual support they felt their family member needed. Due to these negative experiences, they have difficulty trusting and believing that the NDIS would be any different. Lack of education and culturally inappropriate services. The lack of understanding of service providers regarding the interpretation of disability in some cultures has made individuals reluctant to seek help. This is particularly relevant in my culture regarding the interpretation of mental health. The way we explain how we are feeling can be very cultural and misinterpreted by Australian service providers. Example, an individual I visited explained to me her understanding of her condition. Her interpretation in my country would not have been seen as abnormal. The individual felt her condition has been worsened by the medication prescribed to her. She said medication has caused her physical disability and made her vulnerable and unable to achieve her life goals. Financial. Many of the queries by families was their concern that if they receive support by the NDIS, they might lose their welfare assistance. These visits have given me the opportunity to explain the difference between disability pension and the NDIS. However, some are still concerned. For many, they are also worried about losing their carer's pension if they are provided support. Duty of care and responsibilities. Family members may feel it is their duty of care for the individual with disability, and this is cultural belief, lack of trust, and family emotional attachment. Some people think that NDIS will reduce or take away the family responsibilities of caring for their people, and that is their responsibilities, and in some cases, God's will. Appropriate diagnosis. For many families, they have not been able to obtain a culturally appropriate and affordable assessment and diagnosis to help them to apply for either disability services or NDIS. Some successes. While some people felt uncomfortable talking about disability, it was interesting for some others and brought in them a kind of curiosity, as it was something new in my community as part of community awareness. Moreover, some people were impressed by the NDIS project and were very keen to know what it is really about and how it can be useful for people with disability. Having resources translated in my community language was very appreciated by my community members and made my job much more easier. Community members felt comfortable talking to me because I was from the same cultural background. Outcomes, I think we have achieved. Understanding of disability in Australia and the rights of people with disability. Some people are overcoming their old cultural beliefs about the possibility for people with disability to be successful and have a better life. Increase of confidence and self-esteem. Hope for better life for people with disability and their families. This helped some people to have a positive attitudes about NDIS. Awareness of available services and support. Connection of people with disability to current services and support. Social connections between people with disability and their families, and families of people with disability. As people meet in sessions and discuss about disability and NDIS, they become to know each other and become friends. Tips and strategies. Here are some of my suggestions to work through the challenges. Intensively educate people about their disability and ensure they have a clear understanding of what it is and how it will affect them every day and into the future. Intensively educate people of what are the most appropriate supports that should be provided for that particular disability. Help link individuals and families to a support service that will provide culturally appropriate support. Ensure you and any service providers they are referred to use interpreters. Many families may speak some English, and it can be misconceived that they then understand all terminology. Use of well-trained bicultural workers will ensure language support, but also that information is provided in the most culturally appropriate and understandable way. Thank you for the opportunity to be a voice for my community, and I hope that in my future more members of my community will be getting the support they need. Thank you, everyone.